Hello and welcome back to the Pharmaverse Podcast. I'm your host, Michael Pietrack. And if you're a leader or an aspiring leader in the pharmaceutical industry, well, then you're in the right place. Because we interview the best and the brightest stars from all the corners of the pharma universe. The Pharmaverse Podcast is powered by K. Bassman International, the leader in pharma and biotech recruiting. And we're also sponsored by Executive Biotech Advisors, a trusted consulting resource in the biotech arena. Today's guest is Jake Becraft, the co-founder and CEO of Strand Therapeutics, a synthetic biology company that's pioneering programmable mRNA therapies. With a background in bioengineering from MIT, he's leading the charge to transform how we treat cancer and other complex diseases through next-generation RNA technology. Jake Becraft, welcome to the Pharmaverse.
Great to be here. Thanks for having me, Michael.
I saw you at ASCO, and you were talking with someone, and I had just learned that you study Jiu-jitsu. And I was like, I don't want to go up to this guy, a stranger, and grab him from behind. He's probably going to throw me over his shoulder or something.
Yeah, but jiu-jitsu is this thing I got into in grad school, actually, after talking to Jennifer Doudna at a conference. She was not a Nobel Prize winner, but she was pretty famous by that point in this post-CRISPR world. And I remember talking to her about graduate school, and I asked, some question like, what's your best advice? And she said, you need to get into something outside the lab where you could feel successful in, because being in the lab is like science can beat you down so much. And I wrestled my whole life growing up, and I had done jiu-jitsu here and there, and I joined a gym in South Boston, over a decade ago now, and became a huge part of my life. There's an entire table of people from my gym at my wedding. Speaking of podcasts, Lex Friedman used to train there when he lived in Boston and when he was at MIT. So it's a cool community and a cool, it's an incredible just like way to meditate and get cardio at the same time.
Yeah, well, now I'm very glad that I didn't come up and bear hug you from behind and get submissioned in front of 45,000 people. But how has jiu-jitsu, how has the study of that, the mental part of it, the physical part of it, helped you as a leader?
One, as just like a person who works in any sort of a high stress, high energy job, it's super helpful in like this world of like always being on, your phone's always on you. You can always be doing work. You can always be doing things. To have dedicated time to really be mentally present. And so, I don't meditate. I know a lot of people who meditate and try to be very conscious that way. I find it to be almost meditative in that way. And it helps me reset my brain either in the morning or in the evening when I go, or sometimes in the middle of the day if I have, an opening. And it helps me really just kind of reset, refocus, recenter myself and go out to do it. The other part of jiu-jitsu that a lot of people think, they think about it very much as like a meathead sport, right? There's certainly a number of people that may qualify like that who go to my gym, who I love and who are great people. But it's actually an incredibly intellectual sport. There's so much strategy to it. It's like, I liken it to the game of golf. It's something that you can always be getting better at. And in the same way, I think, being a leader, being a CEO, being a communicator, and being a scientist are all skills that you can always be getting better at, right? And you can always be thinking about certain details and things that can just improve your game.
I love the point that you made about how it helps you stay centered, but it's also something you try to fit into your day, starting a company. And I know you have a little toddler running around at home. I mean, how are you balancing all of this?
Ridiculous pursuit of time management, and an incredible support team at work. That's my executive team, right? Who are, people, you hire people that you can completely implicitly trust. I tell people, I want to be able to say one thing and then lose it from my consciousness until you bring it back to me, right? You lose so much when you have people that you're trying to work with that you feel like you need to set reminders and think about checking in on it. Hey, did you get that thing? Where's that thing? I told you to get that thing on my desk. And I find that to be, incredibly mentally draining. And so, people that you can hiring this incredible team that can delegate to, but can also delegate the mental bandwidth of it, right? That you don't have to think about it. You're not having to push it forward. Once it's gone to someone else, they're in charge of it, and having the trust that they will finish it. And then the same thing is true at my house. I have an incredible wife, my wife, Robin, and she is, in terms of managing that toddler, she is such an incredible mother, and, helps me balance both things. And then I'm able to slip in, a gym visit a couple times a week.
Yeah. I mean, I'm a dad of 3, trying to find any time to get a little bit of you time, whether it's to work out or think about things. Like I just kept getting progressively up earlier. And you brought up Strand, so I think it's a good time to talk about Strand. Tell us what you guys are doing.
Strand is a next-generation genetic medicines company. We build next-generation messenger RNA therapeutics coupled with programming technologies, which allow us to actually deliver mRNA therapeutically to different targeted areas through the body. So our whole piece of how we're building these drugs are more potent, more selective, more specific genetic medicines to solve targeted diseases. One of the biggest limitations with genetic medicines and messenger RNA to date has been this inability to really deliver them to targeted areas within the body. We've had, successes with mRNA vaccines, but they're just injected into the muscles in your arm. We've had a few, successes with delivery to areas like the liver, which is where a lot of things tend to accumulate when you inject them into the bloodstream. And we haven't really moved beyond that. And so we needed to find better ways to do that. That's what we're working on here at Strand.
When we were talking last time, it was really fascinating when you were talking about the abscopal response. Tell me a little bit about that, and did it surprise you?
So, to back up, right, our first drug is a messenger RNA drug that is that goes into solid tumor cells and then causes that tumor to send out a signal that stimulates the immune response. And lots of people have tried this. Even Moderna had tried this. BioNTech had tried this. And people outside of the mRNA space had. Well, what we hadn't really seen thus far was drugs that could really robustly not only activate, if you inject into one tumor, and not only activate a sort of immune response and killing and destruction of the tumor that your drug injected into, but actually is able to train the immune system to go out and fight the other tumors and take them out. And that's what's referred to as the abscopal response. So while we had a lot of data going into the clinical trial, and we have an incredible team here of scientific researchers where we believed that we had everything that we needed to see an abscopal response. It's, with drug development, you really don't know till you go into patients. I think what surprised us the most was how early in the clinical trial we saw it, right? In clinical development, you start a trial with sort of the patients who are in the worst shape, right? They've been through multiple different drugs and then even multiple clinical trials before they get to, your first in human sort of trial. You don't go into a first in human trial with a whole lot of options. And so you have very advanced disease and not a whole lot of hope. What we saw in that trial, and what was really sort of shocked us last summer when the data started coming in, was the extent of the responses. And so how much these patients were responding when they, had, in a lot of cases, not responded to anything else, right? Whether that was Keytruda, one of the best-selling drugs in the history of the world, or, some other type of clinical trial, patients who had little to no hope left, responding to this drug and responding in an aggressive way. I think that is surprising to anyone. There's no amount of preclinical mouse tumor data that can convince you that your drug is going to have that sort of a response with late-stage patients.
One of the things that we were talking about is how you have to challenge dogmatic thinking. Can you talk about that and how you're doing that at Strand?
Scientists, we view ourselves as these incredibly data-driven people who always look at things 100% objectively and let the science and the data lead us down. Unfortunately, scientists are they're still human, right? Not unfortunate that that scientists are human, but the unfortunate side of being human is that you're not going to escape that and become 100% objective just because you're a scientist. And so the past always colors the perception of the present. In drug development, for instance, they'll say, intratumoral drug, injecting things directly into tumors doesn't show abscopal responses. It shows it, in this case, but since it doesn't show it, that means it can't show it. And those are two different things, of course. It's like, our inability to do something up until now is not a prediction of whether or not that thing is possible. It's an indicator of how successful we have been at doing that thing, right? We haven't proved an impossibility. We've just proved how hard something is. I'd say that when we first started the company, we found all of this sort of dogma very frustrating, whether it was, about intratumoral drugs, whether it was about what the challenge of messenger RNA is, right? The big thought on messenger RNA was that its challenge was delivery. And our approach was that while delivery is certainly one of the things we need to work on, getting the mRNA actually into the cells that we care about, the thing that we care about at the end of the day is the expression, right? That's sort of this, to use a very, very overused term, the first principles thinking, which is, what do we care about at the end of the day? We care about the mRNA's expression, how much it expresses in the tissue that we're targeting, how much it expresses or doesn't express, hopefully, in the tissues that we want to avoid. And so that design and that build out of messenger RNAs in that sort of a way, people just weren't willing to hear it. They just kept saying, well, with delivery is the only solvable thing, or lipid nanoparticles only go to the liver, so you'll never be able to solve it. And those are fundamentally not scientifically true, but you have to fight through that dogma. You have to fight through people's preconceived notions. And sometimes you just have to, abandon hope with certain folks and just say, okay, well, I'll just have to prove that it does work this way, right? And I really wish that there were better ways to sort of challenge various different dogmatic thinking within science, but unfortunately we run into it quite a bit.
When someone researches you, you're out there saying that failure is part of success. I happen to agree, but can you give us an example of how failure had led to the success that you had?
I think that my failure to actually, get into first to get into MIT as an undergraduate, right, helped actually force me to, I stayed in Illinois, which is where I grew up. I got to go to the University of Illinois, and this is, I love the University of Illinois. I love MIT, two wonderful schools. I got to go to both. I'm an incredibly, incredibly lucky person. They're both very different, right? University of Illinois is a Big Ten school. It's giant. And what I didn't realize at the time coming out of high school as a, very nerdy, but very, very socially inclined, but wanting to eat science for breakfast, lunch, and dinner kid. And that's why I wanted to go to MIT so badly. What I didn't realize is that where I needed to grow up and refine my skills probably more than anything was interpersonally, right? I needed to develop those skills, those communication skills. And for me, going to a school like the University of Illinois that is incredibly diverse, where, most, if not all of my core group of friends weren't engineers, they weren't scientists, they were marketing majors and communications majors and people who live next to me in my dorm who I know, it's a 40,000 person school with a ton of different things. I got to then go to class and get a world-class engineering education, but, my social life got to be much more mixed and diverse than it may have been if I had gone to MIT, which is an incredibly technical school that has, there's a different world, different universe that I could be having the opposite decision where, MIT was the greatest thing ever when I was 18 years old. But that was super important for me. And then it helped, me be in the right place at the right time to start this company and really color my entire life through going to MIT for graduate school. I'd say at the same time, right, when I came to MIT, my goal and what I was really building towards was trying to be a professor. I thought, I had worked with Bob Langer one summer when I was an undergrad, and I saw, this world where he got to do amazing science and then spin them out into, 1,000 different companies. And it's, just seemed like this beautiful world that you could be a part of. And then, at MIT, I quickly realized a few things. I'm not that good at that, research, at leading those research labs in that way.
I see.
I could see in my class the people that could do it. And, I'm not very good at writing grants. I'm not very good at, fitting in the way that the federal government wants you to write these things for a lot of the grants. And, I knew at that point, like, it became very clear that I was not going to make it in that world. And so that sent me down a spiral of personal reflection and sort of an identity crisis where I had to, I sort of just spun out and tried to figure out what it is. If I'm not, I'd been on this, I want to be a professor track since I was, maybe 19 at Illinois, where I was like, well, if I get into MIT, then I'll have a PhD from MIT. It's a huge launching point to an academic career. I'll do all of these different things to set myself up. And this is what I'll do. And 2.5 years into MIT, I realized probably not going to happen for me anyway. And I don't even know if it's the right fit for me, like personally, like it just doesn't fit with my vibe and my want. And I don't see a path forward here. But like, what does that even mean for me? 24 years old and just trying to figure out like, should I even be in a PhD program? And so I boiled myself back down to what I didn't call at the time, but I guess what was the first principles of me, which was, what is my core tenet? What is my core belief? What is the core thing I want to spend my life on? And what I realized as I tried out all these things, from like science policy to, different sorts of communications, working with nonprofits, to, just burying myself in my research and ignoring everything else, and venture capital, and looked at all these different things. And what I realized was, I care about translational science. I care about taking discoveries and getting those discoveries into people and getting those discoveries into the world where people can actually utilize them. And so that's what I needed. That's what I need to find. And that ended in me starting a company.
Yeah, it led to a great success. I have a very similar thing that happened to me, all related to baseball. But that's another show. But, growing up in Chicago or Illinois, most young boys and men, they want to play for the Cubs. They want to play for the Bears. They want to do that. And then I'm picturing you as wanting to go to MIT. Do you remember any points throughout childhood where you showed glimpses of this entrepreneur that's sitting here today?
So I grew up in a very, very small town, about 1,800 people, farm town. So very far from what is Chicago. I mean, 3 hours away, but culturally a world away. There wasn't really science there. There's crop sciences that people utilized as farmers, but for the most part, it's a very agricultural society. My high school wasn't actually even in the town I grew up in. It was too small, so we had to go through the cornfields to the next town over to go to high school and to go to the post office. And that was there's a lot to love about a small community. For a kid that wants to be in science, it can also feel very isolating, right? There's nothing to say about the scientific chops. There's just not science jobs, research labs in the area. And so, it creates this, luckily the internet existed then. And I, was able to do a lot of research that way, watch a lot of like Discovery Channel and National Geographic. On the entrepreneurial side, the biggest inspiration in my life growing up was my late grandfather, Warren Reynolds, who was a local small business entrepreneur. He had been an executive at a company for 30 years in Peoria, Illinois, the local city nearby. And then he had started, he retired with his 30-year pension in his early 50s, as many people in his generation did, and then went on to have another 30-year-long career where he, struggled to fully actually retire himself and continued to start small businesses and get involved in local government. And I think that, working with him, just, growing up with him and being able to see how he built some of these businesses, it helped me. I don't know, either I inherited it from him or I osmosised it from him. This idea that, you can build organizations to do really interesting and cool things. That was something that was just sort of core from that early childhood.
That's really cool. Thanks for bringing him up. What was like the number one leadership thing that he taught you that you still think about today?
He was a huge believer in teams. I never knew him. He was, retired from his, executive job, his, vice president job at this local company in Central Illinois by the time I was, born or conscious or making new memories and whatnot. But, he was still running all these different businesses, and they were, his real estate businesses and, a t-shirt manufacturing business and doing all of these different things around. And his, this core piece that it came down to was, how do you run a business and not let it run you? And how do you have so many different businesses? And it all comes down to teams. So every one of his businesses, he had sort of his core person, right? This person that, he trusted, who was competent, who was going to really focus, and then someone who he incentivized, right? These, he had started the business, put the capital up, but, in a time, this is the 90s, right? Where, I think outside of Silicon Valley, there weren't a whole lot of people talking about equity as a compensation driver. And he really drove that as a point of, giving people stakes and things that he was doing. And I just remember learning from him, talking to him and hearing about how he would build these teams and build people's conviction in what they were doing. And, I think that helped him do so many different things, and it helped him have a business that he could run without just, and the business runs you, you're just running around trying to put out fires all day. It's incredibly taxing and very hard to do much of anything else, especially, think creatively about the future of any of those businesses.
Man, that is describing me in a nutshell right there. I needed that advice. One of the things you said about hiring that has also stuck with me since our last conversation, you said when you hire someone, you're looking for a pick up the broom mentality type person. So what does that mean?
Yeah, we something that I started saying really early on in the company was that if you work at Strand, we're hiring you to do some, and you could be, we hire all sorts of experienced biotech executives and scientists, but we need people who have a pick up the broom mentality, right? And so what that means is if the floor is dirty, somebody needs to clean it, right? And if you're there and you're free and the broom is sitting there, you pick up that broom and you clean the floor because you're not above it. No one's above it. No one's above any job at the company. There's a division of labor and there's division of pieces, and people have the things they're trained on and doing different things efficiently. And we don't hire a VP and ask them to intake the shipments every single day. But at a certain level, there's nothing that is above or below. There is no job that is on a hierarchy of importance. And there is nothing that anyone is above or below. And that goes all the way through the entire organization, all the way up to myself, my co-founder, anyone else, right? It needs to be, if a job needs to get done and you're able to help do it in that moment, you should have the mindset that you should do it because it will help the company, right? It will help things happen. And I think that helps set, this cultural flatocracy, right? You can't have an actual real flatocracy where everyone is the same as everyone within an organization. There has to be chains of command. There has to be, ways to push messages and communicate things and build, consensus. But you do want a cultural flatocracy and one where in a meeting, an entry-level lab technician scientist can question the head of R&D or the CEO on something that is technical that they know of. They might not be like, hey, is that the best financing solution? That would be, maybe strange, unless it happened to be really, insightful. Yeah. But in general, if you have someone who's a senior research leader who's sort of pushing us down an angle, you need a cultural flatocracy that allows and empowers and really encourages and celebrates, someone who's lower level, at least functionally questioning it and being able to have a debate as intellectual equals, right? Especially when, some of our lower level, our folks at the more early scientist level are spending the most time intimately with the details of the science. They're reading the papers, they're working at the lab, they're getting the data first. And so I think that across the entire organization, what we hope is that there's an incredible level of approachability as well. And you can always, there is no one who is above questioning in a respectful way that gets to the debate and avoids dogma.
That's it. A nice punctuation mark on the whole podcast, because we are out of time, unfortunately. But Jake, as I suspected, great interview, so many insights, so many things I'm going to take back to my team, and I'm sure everybody listening is very grateful to have listened. So thank you for being a guest on the Pharmaverse.
Had a wonderful time. Thank you for having me.
Well, that concludes another episode of the Pharmaverse Podcast. We have many more exceptional leaders lined up for you, so subscribe to the channel so you don't miss a single insight. But for now, that's a wrap. See you next time on the Pharmaverse.